Some lady came up to us at this reception, and I think she told some personal story from her family. But at any rate, what she was talking about, of course, was the need for a public psychiatric hospital in Harris County. And I believe there were, at that time, Houston was the largest, certainly the largest city in the country, maybe in the world, that did not have a public psychiatric hospital. So after this lady finished her discussion of the need for such a facility, which John Lindsay and I, of course, were very much aware of, John remarked, said, well, you know, he said, I've got some bond money. Nothing I'd rather spend it on than building a county psychiatric hospital. And I said, well, let's get to work on it.
As Lieutenant Governor Bill Hobby shared at the 20th anniversary, the impetus for establishing Harris County Psychiatric Center, now known and loved as HCPC, came from the community. But the vision and the know-how to make it happen came from negotiations between the state, including Health and Human Resources, the county, Harris County, the hospital district, Baylor Med, and the Med Center. HCPC actually was created by the Texas legislature in 1981, but it took a few more years to work out the details before holding the groundbreaking ceremonies at the McGregor Street Leland Anderson campus in 1984. Our official birthday begins on the day our first patient was admitted, October 22nd, 1986. Once HCPC was up and running, Dr. Felice retired and was succeeded by Dr. Robert Gwynn, Psychiatry Department Chair and HCPC's Executive Director from 1987 through 2007. Within a few years of opening, HCPC received its JACO accreditation, which it has had since. In fact, in 2015, we were one of a handful of mental health hospitals to receive the Joint Commission's award for key quality measures. 1990 was a great year for everyone when HCPC became an official operating unit of the University of Texas Health Science Center at Houston. Within a year, we showed our commitment to education by establishing a learning center for psychiatric residents on site. Look closely and you'll see Dr. Schneider. Also in the early 90s, we increased our commitment to hiring activity and occupational therapists to provide programming for patients. We received our official Medicaid provider number in 1992 and became the first freestanding psychiatric facility in the state of Texas. Shortly after, we finalized our Memorandum of Understanding with Harris County MHMRA, which clarified funding arrangements going forward. And before long, we officially opened 365 days a year and celebrated our 10th anniversary. At HCPC, anniversaries aren't just parties. They're a reunion of people who have grown to love each other and this place and are committed to ensuring its success. The new millennium brought a focus on specialized care. HCPC opened its subacute unit serving adolescents ages 10 to 17 in 1999. In 2000, Lois Moore joined HCPC as Chief Nursing Administrator. And in 2003, we strengthened our commitment to education by establishing the hospital-wide education building. Having this space contributes to our ability to educate approximately 2,000 students every year. The focus on serving special populations continued with the opening of the Residential Treatment Center serving ages 13 to 17 in 2006. Within a few years, we opened a unit serving inmates of Harris County Jail, and this evolved into our Competency Restoration Unit funded through MHMRA in 2012. Dr. Samoan Johnson, pictured here, was integral to its implementation and success. 2009 saw the arrival of Dr. Jair Soares as Executive Director and Psychiatry Department Chair. His expertise in mood disorders has brought international acclaim for our research and treatment for bipolar disorder and depression. The ensuing years have seen the opening of additional specialty units. the schizophrenia unit in 2010, led by Dr. Wasef, the bipolar disorder unit led by Dr. Teresa Piggott, our dual diagnosis unit for patients with co-occurring mental illness and substance abuse disorders is led by Dr. Krajewski, and our social services team is expanding these services through our collaboration with the Council on Recovery. In 2012, we held a dedication of the Lois J. Moore Child and Adolescent Treatment Unit in 1E. The arrival of Chief Operating Officer Steve Glazier in 2013 has brought many fresh ideas as well as a plan for renovating each unit. Our goal is to renovate every unit by 2018 with the help of funding from Harris County. The first unit to undergo renovation was our mood disorders unit. In 2015, we expanded available services to include our ECT clinic, which serves the outpatient community as well as our inpatients. And our newest unit, which opened in April 2016, is our geriatric psychiatry unit, which works in collaboration with the Consortium on Aging. In the past year, HCPC has grown its psychology internship program and implemented universal protocols for assessment and research, allowing us to tap the data established since converting to our electronic health record over a decade ago, considered a visionary step at the time. These are just a few highlights of HCPC's growth and success. It all started with the vision of a handful of committed people. With the vision of committed people going forward, just imagine where we can be in 30 years.